Again, this does not have to be more work than it needs to be. HPI, definitely greater than 4. Review of systems, all 9. We did all 3. So from our history portion, we're clearly in the 204, 205 range. PE, we did a general multi-system exam. So again, we hit the 204, 205. Medical decision making, we got points for new problems. So that's what we need for our points. We hit our data because we ordered labs, imaging, requested records. She's clearly in moderate risk, chronic illness, exacerbation, managing meds. So this is a very easy, straightforward 99204. The piece that most of us miss is getting enough physical exam. And for a new patient, you have to have all 3 elements meet or exceed the standard for the code that you bill. So that's the piece I leave you with as far as imploring you to make sure you get that physical exam in. So to round things out here, billing by time. There is a rule in CPT that says if you spend more than 50% of a face-to-face visit in counseling or coordinating patient's care, you can code the visit based on time, even if your history, exam, or medical decision-making elements are lacking or not up to that level. So that's great. You can't fully rely on that though, because remember, they like medical necessity. They think medical decision-making or complexity is very important. So yes, it's a rule, but sometimes it will ding you, and if you do it over and over and over again, like anything else in the billing world, it's not going to fly. So what you do in your face-to-face time is reviewing problems, adjusting medication doses, counseling or coordinating. When you don't have enough history or exam, that's when this would be appropriate to do. Can't do it every single visit. I would not advise doing it on every single new patient to get the 204 or 205, because those new patient visits require all 3 elements to bill. So even though the rules say one thing, if you do that every single time, you may get in trouble eventually. It also specifies, and this is where I run into people's chart notes, they say visit 60 minutes, spent greater than 50% in counseling. And that's the extent of their sentence on that. That's not going to fly. When you do this counseling, you need to make note of what it is that you did in that 50% of time, especially when you're talking about 30 minutes of a 60-minute visit in counseling. In their minds, it has to be medically necessary. So what were you talking about for 30 minutes? Think about it in those terms. You then use their terminology. The pieces that are medically necessary to them for counseling includes discussion of test results, diagnostic or treatment recommendations, prognosis, risk and benefits of management options and or not doing things, instructions, so this is your treatment plan instructions, education, compliance, or risk factor reduction. You need use those terms, use those nouns and adjectives in your statement of what 60-minute face-to-face visit, greater than 50% in counseling on their most recent test results, of which CBC, etc., were normal, thyroid was abnormal, and then this is my treatment, this is what happens if they don't do it. You don't need to write it down verbatim, every last piece of counseling, but you need a synopsis of it. That's going to justify your billing by time, and then lacking the physical or lacking some other component of the billing. So use their terminology. Make sure you do more than I spent